That ought to work, shouldn't it? I didn't stand down here. I don't know. Yeah, I mean, I just want to make sure they can pick it up. Okay. This is the 3rd. Okay. All right, we'll call the briefing to get started on the 3rd of September. I've not, want to welcome everybody. I've not heard all the numbers on today's report, but I understand that the manager has some good news on some of the aspects of our report. We just want to remind folks to continue their commitment to staying healthy, protecting themselves, and so the city manager will come and make some comments about the numbers. Annette Rodriguez will come then and give her position and information that she has, and County Judge Barbara Canales will be here to share with us what she'd like to have information she wants to share with you in terms of the COVID and other items. So we'll get started. Again, from information I have, and I've not heard the numbers other than that Peter kind of had a little grin on his face, so he said, we got some good news, so I'm looking forward to hearing that. So we're always ready to hear some good news. So Mr. Zanoni, if you want to come up, we're ready for a little bit of good news.
El día de hoy hay buenas noticias en cuanto al reporte del día. La directora de Salud también va a dar su información, seguida por la juez del Condado de Nueces. Ahora el reporte del administrador de la ciudad, Peter Zanoni.
That's it. Okay, good afternoon, everybody. I'm Peter Zanoni, Corpus Christi's city manager. I'm going to share with you the numbers, the number of new confirmed positive cases, talk to you about the hospitalization changes, and talk to you about number of deaths as well for Nueces County. After that, I do have a couple of slides just to show us some of the governor's orders that are still in place. It's been some time since we've talked to the community about them. And it's probably good just to remind ourselves what is the kind of the law from the governor for individuals to follow when it comes to COVID-19. So I have a few slides. It's a complicated order, and but we'll try to just show you some of the things that'll keep you following those orders of the governor through this Labor Day weekend and even beyond. Okay, so let's begin by talking about the number of new cases. And so today we're reporting 26 new COVID cases for the Nueces County area. That 26, in addition to the 26, there were 7 cases reported to us from the state data drop, and those range from the date of August 17 through August 31, so they don't impact today's number, but they have been placed into the appropriate days. And so the chart you're seeing here has both the cases confirmed from the health district as well as the state data drop cases. Those have been distributed in these numbers that you can see here. So 26 for today. Yesterday there was 21 new cases. You can see that things are looking much better. The two high numbers there, the 243 and the 172, those are from the Robstown Area Detention Center. And that's why those days spiked up. There was a third day also that's not shown on this chart where there was some Robstown Area Detention Center numbers. But if you take out those two spikes, you can see that our numbers are looking a lot better. They're still a little bit concerned. We want to be at that 0 number that we used to be at, or 1s or 2s. But we'll take 26 over 400 for sure. This next chart shows us the two different sets of numbers. The purple, blue is the health district number, and then the yellow are the state data drop numbers. So they're just shown side by side rather than on top of each other or incorporated into each other, as what we saw on the previous graph. And then this next chart puts them back on top of each other, but gives you a color differentiation. And so the blue is the health district numbers, and then the yellow are the state data drop numbers. This graph shows you a much longer time frame, beginning in June 1 through present. So you can see in that mid-July, it was around July 15 or so, this most recent outbreak or wave reached its peak, and it's been slowly coming down with some outlying days there with some higher bars than others. And we explained some of those here with the Robstown Area Detention Center. But you can see kind of the curve on that graph here. And then our next graph is what we have referred to as our donut chart. This shows three groupings of individuals impacted from COVID: the recovered, the active, and then the deaths. And so one thing you'll notice today is we're doing real good on the recovery rate. 86% of all persons that have contacted COVID since the beginning of time have been recovered. And if we remember that graph we showed you earlier, a lot of people were impacted in that July, August timeframe. So the days that have lapsed now, people are recovering. We still do call persons that were diagnosed with COVID to walk them through a series of questions to ensure they're recovered and make sure they're doing okay. We do that for every person impacted. So 16,000 recovered to date then, and that leaves us with about 2,600, close to 2,700 persons that are still with the virus, that are still active. And then there's 368 deaths since the beginning of us counting deaths on this pandemic. Okay, when it comes to hospitalizations, 3 fewer persons in the hospital today since yesterday. So there were 136 persons in the hospital yesterday. Today there's 133. So a little bit of progress there. This line is coming down slowly, not as fast as the number of persons with the virus in those prior charts, but we're making improvement. And of the 133, 61 of those persons on this next chart are recovering in ICU, meaning they need more medical assistance than the general person in the general setting in the hospital. So 61, which is an increase of 3 since yesterday. Yesterday there were 58 persons in ICU, and today there's 61. Okay, and then the number of deaths. This number 368 is the same number that we had yesterday. And so that's one positive, is that today there are 0 deaths, no new deaths to report for Nueces County. And the last time we were able to say that was the first week in July. And so for every day since that first week in July, all of July and all of August, we've been reporting deaths with probably like an average of 9 or 10 a day. And so they've been coming down the last couple of days, and today 0 deaths in Nueces County because of COVID-19. Okay, and then this final chart just shows us a longer trend line since the beginning of April. And it shows us the daily numbers in the blue bars, and then it also shows us a trend line. And you can see a couple of blips way back there in May, but most of the analysis and time has been spent on this big outbreak that took place in late June through July and August. You can see the red line shows us a 7-day average. And so we reached the peak about mid-July, and it's slowly coming down here in September. The current 7-day daily average, so the current daily average based on the last 7 days is 49 new cases every day. And so today, the number of cases we had was 26, so it's about half of that daily average, which is looking good. Okay, now I'm just going to go through 3 slides, and the governor's orders, if you all haven't seen them, are complex, and they have a lot of exceptions and groupings, and But we thought it'd be important just to try to take you through these, just 3 slides, to just kind of give you some general highlights and guidance. The governor's orders are online on the state website, but we just want to remind you about 3 things. That includes wearing face masks, outdoor gatherings, especially with activities happening over the 3-day weekend, and then occupancy guidelines. We still get comments from the community about how many people should be in the restaurant, what's the occupancy. I've heard some rumors about occupancy levels have changed, and the same is true in terms of not clearly understanding gatherings outside, and then masks guidelines as well. Okay, so on mask guidelines, well, these are the governor's orders. Everybody here at the city and county recommend you wear a face mask as much as you can and as often as you can. But the governor's guidelines say that masks must be worn when it's not feasible to maintain 6 feet of social distance between 2 people. So that includes in a shopping area, if you're at an event where there may be a big crowd, or if you're in a crowded public space. So businesses and other entities can make coverings mandatory. So if you're going into a restaurant, a bakery, any commercial, private business, if that business mandates that you wear a face mask in order to enter, that's their right to do so. And if you don't have a face mask on, and if they ask you to have one on, then you won't be able to go in. There are some exceptions, so face masks do not have to be worn for those that are under 10 years old. If you're outdoors exercising, you don't have to wear a face mask. If you're eating or drinking while seated, like in a restaurant or a coffee shop, you don't have to wear one. If you're publicly speaking, if you're swimming in a body of water, you don't have to wear one. If you're at a religious event, a place of worship, you do not have to wear one. And then if wearing a face mask poses greater mental or physical health issues, you don't have to wear one as well. And I think we know that. So the key thing is, if you can't maintain that 6 feet of social distancing, you should wear one, according to the governor's orders. But we do want to remind people, and I believe, and I think Annette can talk to this, that the reason we've seen these better numbers today in this last couple of weeks really, has been because of the face mask. I see it myself in the community, and convenience stores and grocery stores, even just walking along the bayfront. You see a lot of people, more and more, are wearing face masks, and we believe that has a lot to do with the numbers coming down. Okay, so outdoor gatherings, I think, is the next one. Actually, let's stay here on occupancy guidelines. So this one, that third bullet here, has a lot of exceptions, on how many people can be in a facility. And it's a long list. We don't have the space to show it to you here, but there is no occupancy guideline from the governor if you're on an essential services list. And also, there's no guidelines if you have religious services, government operations, childcare, recreational sports, museums, libraries, and salons, so long as you can have 6 feet of distance between workstations. But except for that long list of exemptions, every business in Texas shall operate, this is according to the governor's order, at no more than 50%. So that 50% is still in place, and that includes for things like restaurants, and movie theaters is another good example. So the 50%, that's the key message today. I wanted to let people know that restaurants, movie theaters, places that are not exempt, they should not be at any more than 50% occupancy. Also, bars should not be visited. You can't go inside unless you're, the only way you can go to a bar is to pick up something through drive-through or to have it be taken out. So bars are still, by and large, closed according to the governor's orders. Okay, and then the final thing is the outdoor gatherings. So this is important because we know people will be at the beach, maybe at parks, maybe even in other settings over the weekend. So the governor's orders state that groups should not be larger than 10 people, and they should maintain at least 6 feet from others when in those groupings of 10. This does include families. Okay, so let's use the example of the beach. So if you have a big family, you have some extended family coming down, and all of a sudden your group is turned into 14 people, that would be breaking the governor's orders. So you want to kind of separate the group, maybe have 2 different groups, but group sizes shouldn't be any larger than 10, and you should also maintain at least 6 feet distance from others. There's a note where the mayor and the judge can grant special permission if safety protocols are in place, and we've had some of those that have come in over the last couple of weeks. There are some exemptions from this. That includes youth camps, sport programs, pools or bodies of water, if you're in those water amusement parks, museums, libraries, and zoos, child care, and local government operations are some of the exemptions. Okay, so hopefully that helped. This is not new news. It's just wanted to reintroduce it to the community because the governor's orders are still in place. And those orders are meant to reduce the spread of COVID and keep people safe and save lives. So you can get a whole list of that on the governor's website. And you can also ask us, the city, questions. If you have questions on them, we can help you with those. Okay, so with that, we're going to get this translated by Gabby into Spanish, and then Annette Rodriguez, our public health director, is going to come up next. Thank you.
En las últimas 24 horas se han reportado 26 casos confirmados por el coronavirus y 7 vienen por parte del Estado, las cuales fueron el resultado de pruebas tomadas entre el 17 y el 31 de agosto. 16,003 pacientes se han recuperado por completo, 133 continúan en el hospital, 61 están en la unidad de cuidados intensivos, 2,679 son casos aún activos. El día de hoy, afortunadamente se reportan 0 fallecimientos y a la fecha los fallecimientos totalizan 368 personas. En cuanto a las órdenes del gobernador, quiero aclarar y recordarle a los residentes que estas órdenes continúan vigentes. En cuanto a las pautas del uso de cubrebocas, cada persona en Texas deberá utilizar una cubierta facial sobre la nariz y la boca cuando esté dentro de una entidad comercial u otro edificio o espacio abierto al público, especialmente cuando no se puede practicar el distanciamiento social. Los dueños de negocios pueden hacer obligatorio el uso adentro de su negocio. No es necesario que los cubrebocas faciales sean usados por menores de 10 años o al hacer ejercicio al aire libre, comer o beber, hablar en público o cuando hacerlo afecte la salud mental o física. En cuanto a las pautas de ocupación adentro de establecimientos, todo establecimiento comercial en Texas operará al 50% de ocupación. Están exentos las iglesias, las operaciones gubernamentales, el cuidado infantil, los campamentos juveniles y programas deportivos para jóvenes y adultos. El límite de ocupación no se aplica a los servicios de belleza y cuidado personal que imponen una distancia social de 6 pies. Y en cuanto a las reuniones al aire libre, están prohibidas las reuniones al aire libre de más de 10 personas. El alcalde o juez del condado pueden otorgar permisos si existen protocolos de seguridad, excepto en campamentos para jóvenes, programas deportivos, piscinas o parques de atracciones acuáticos, museos, bibliotecas, zoológicos, rodeos, cuidado infantil y operaciones del gobierno local. Ahora la directora Annette Rodriguez del Departamento de Seguridad Pública nos va a dar su reporte.
Thank you. Annette Rodriguez, Health Director. COVID-19 positive individuals who need advice and or guidance regarding COVID-19 health concerns, please call the COVID-19 Outpatient Clinic at 361-826-8019. As a community, we need to make sure that we are preparing in every way possible to protect ourselves from getting flu and COVID-19. We do not want to get sick with the flu this flu season, and it is mistaken for COVID-19, which can easily happen. These viruses are cousins to each other. They are both coronaviruses. It is advised by CDC to get the flu vaccine mid-September so that your body has time to build some immunity against the flu. Flu season starts October 1st. What does prepare now for flu season actually mean? It means to do certain things now before we're in the middle of flu season. Number 1, refill your daily medications now. Call your doctor and get it all worked out where you can have medication refills through April of next year. There should be no reason for you to have to be at the pharmacy in the middle of flu season with potentially sick people when you are not sick and you only need your scripts refilled. So please take care of that now. Number 2, help out elderly or vulnerable neighbors. Speak to them now about allowing you to pick up groceries for them or helping them to order through curbside. Some of the elderly are not as computer savvy as the younger population. This might be a really good time to get your children involved and feeling useful. These individuals over the age of 65 or immunocompromised in any way should not be grocery shopping in the middle of flu season because there may be people there that are infectious and they don't even know it. Help out your vulnerable neighbors. It's the right thing to do. What you don't want to do is expose your children to the vulnerable populations. So be very careful with that. Make sure that you have a way for them to call these neighbors and get their groceries ordered and picked up, and then they can drop it off on their front porch, walk away and call them and let them know the groceries are there so they don't come in contact with each other. Number 3, students that are off in college and get COVID-19 are not going to be released home to quarantine. In March and April, we saw many schools close down due to increased number of COVID cases. We will see these numbers increase exponentially again as colleges and universities reopen. The difference is that CDC is recommending this time that students stay and quarantine where they became ill, and that they do not travel home and infect people along the way on a plane trip and also take infections to another part of the world. School districts, I'm talking about elementary now to high school, they're gearing up to open face-to-face classes next week. So many of them are choosing to still do virtual classes, but they also are giving parents the option if they want to do face-to-face instruction. As our children go back to classrooms, parents need to talk to their children and give daily reminders on how to properly wear their mask. Younger school-age children should also understand that masks are not to be shared with their friends and that they need to make sure they do not take them off. Write their names on the mask so that mask sharing can be reduced, if not eliminated completely. I mention this because at some point, it may happen that your kid comes home with a different mask, and he or she will tell you that Johnny's mask was so much cooler than his, so he traded with Heather, and Heather switched with Daniel, and that's how they ended up with different masks. Properly wearing masks is going to be key this flu season. It will help stop the spread of both flu and COVID-19. It is important to also wash reusable masks. For kids, and especially the younger ones, masks should be lighter in color. Dark color fabric is difficult to tell if they're dirty. Lighter colors will allow parents to see if their masks are soiled. Soiled masks should be washed, as other germs could also live on them. Lastly, just to remind everyone that just because we have a holiday coming up this weekend, please do not take a break from COVID-19. As much as we all need a break could end us up in the hospital, and no one wants that to happen. We need to continue being proactive and continue using our basic public health prevention tools. Let's all do our part to practice every precaution available to continue to reduce contracting the virus, with the goal of eliminating it completely. Wash your hands often. This is going to be your best defense in fighting off germs. Wash your hands, especially before touching your eyes, nose, or mouth. That means not touching your contacts, not touching your eyeliner or your braces, or using lip balms with your finger, no biting your nails without washing your hands first. Social distancing of at least 6 feet from strangers. Stay completely away if possible. Stay home if you're feeling sick. Get your flu shot this year, even if you've never gotten it in the past because it makes you feel a little ill. That just means it's causing an immune response, which is actually a good thing. Stay as healthy as possible. Stay ahead of what is coming by preparing now. And always stay informed. Help anyone less fortunate than yourself. Solidarity is critical if we are going to be successful in combating this virus before next summer. Thank you.
Para las personas que han resultado positivas al virus, les recordamos que puede llamar a la clínica para obtener orientación. El número es el 826-8019. La época de gripe comienza el 1 de octubre y los síntomas son parecidos a los del COVID, por lo que es importante estar vacunado con tiempo para que el cuerpo comience a crear inmunidad y así evitar tener el COVID. Se puede preparar tomando varias medidas, contar con suficientes medicamentos para así evitar ir a la farmacia y evitar así un contagio. Ayude a sus vecinos y a las personas de la tercera edad, tal vez yendo por su despensa o haciendo pedidos a través del curbside. Si un estudiante de colegio llega a enfermarse, es recomendable que se queden en el área donde están y lleven ahí a cabo su cuarentena y no regresen a su casa, ya que el viajar pone en riesgo a más personas, así como a los miembros de su familia. Muchos distritos escolares tendrán clase en persona la próxima semana. Recuérdele a sus estudiantes el usar su cubrebocas de manera correcta y sobre todo que no lo compartan con nadie más. El usar cubrebocas también prevendrá que enfermen de gripa. Si usa cubrebocas de color claro, podrán ver más fácilmente si este está sucio o opte por usar un cubrebocas desechable. Le queremos recordar que siga tomando todas las medidas de salubridad, especialmente durante este fin de semana feriado. Así evitaremos que las cifras aumenten en unos días y esperando pronto erradicar los casos por el coronavirus. Ahora la juez del condado, Bárbara Canales, va a dar su reporte.
Gracias, Gaby. Thank you, Barbara Canales, Nueces County Judge. Lots of important messaging today. I think you've already heard. I don't know if it's been a while since I've been able to come to this room and really smiled. So I take off my mask so you can see not only in my eyes but on my face what joy it gives me to know that nobody died today in our county. That is the best possible news that we can have when we come before you to public message. But I'm also watching with anticipation what our numbers will look like in a few weeks. And although it is unbelievable news that these cases are so low in our community, relatively speaking to where we have been, I'm still watching those ICU numbers and that slow slope of declining hospitalizations very carefully. I want to address more about COVID-19 shortly, but because we're still smiling, let's talk about some good things right now. First, a very quick public service announcement, and this one is also worthy of a great smile, and that's the Corpus Christi Museum of Science and History has 40 spaces open in its Museum Academy. This is an academy that offers a full-day program at the museum that will guide children through remote learning sessions along with educational support activities created by museum educators. The program is designed to assist working parents during the school-mandated distance learning and provide engaging, safe, and productive environment for children's K through 6. The Museum Academy is designed to be affordable for working parents, and scholarship assistance is available. So, for more information, go to ccmuseum.com, ccmuseum.com. As I get great information that crosses my desk, I'm a parent still. My child is still in school. I'm thinking about every single resource I can give them, and I want to bring those to you as well. So I'd like to remind you again about another unique program that's available through Nueces County and Nueces County Public Libraries, and that's through ucmore.com, ucmore.com. This is an unbelievable opportunity to get online resources, tutoring, and all kinds of learning programs through our library. Okay, now as they say, a little bit more about the heavy stuff. This is, my comments are really divided up into three parts: beach hazards and safety, hazards, safety, and coronavirus. And first and foremost, I want to talk about something that doesn't have to do at all with COVID-19, but it has a lot to do with the beach, and that is a beach closure order that was passed by unanimous vote all 5 of us, in Nueces County Commissioner's Court on Wednesday. This is a very specific order, and it's directly as a result of Hurricane Hannah's storm surge, which caused significant damage to Bob Hall Pier, destroyed our parking lot at Padre Bayi Park, which is, of course, right by Bob Hall Pier, and the debris that was littered across our beach still poses a danger to pedestrians. We are in the process of this cleanup with the General Land Office, our state agency partners, and even though great progress is being made, there is still a very urgent need to restore safety to this area. There is a dune line where significant erosion has occurred, and we need heavy machinery in this arena. Because of all of this, we need to ensure safety for the public from the debris, allow this heavy equipment to come in. We exercise together as a court, unified, our authority to close areas of the public beach under our state-approved Nueces County Management Plan. I was even thanked by one of my greatest critics today, and I'm very grateful for your thanks, because this is an excellent way for all of us to find common ground. It gives me great confidence in government to not only work together for the efforts of public safety, but also for the recognition by those who understand that when we do act in unison, it is definitely for the common good. 2 things you should know. We did the smallest area of restriction that we possibly could. So when you go to the beach this weekend and you see this area, please know this was the best construction, I would say a restricted area due to construction that we could possibly do. We're going to keep it closed for the shortest amount of time possible as well. So it's the smallest area, and we'll keep it restricted for the smallest amount of time. These are very important. So I'm going to ask that you please observe the caution signs and stay out of these restricted, closed areas. Please allow the work to be done, and let's get this back restored healthy and beautiful as soon as possible. Now, that was a little bit about orders and hazards, and now I'd like to turn to the coronavirus and Labor Day weekend. Manager Zanoni did a great job. He went over those governor's orders. I'd like to personalize it just a bit. Here are the facts. Texas leads in the nation this week in new deaths. Let me say that again. Texas, our state, leads the nation in new deaths this week. Texas is number 2 in the nation, posting 30,000 cases in 1 week. Nueces County, for all the great work that we've done to drive our numbers down, are still in the top 10. Remember, there's 254 counties. We're still in the top 10 in the ratio of deaths per cases. Now, we have gone from number 1 way up there in the country for our cases, all the way to just staying in this top 10 list, and we're, I think, number 9. So I'd like to get us out of this top 10 list, but make no mistake, when you get very ill with this virus, we have a very high ratio per capita of death, 1 in 52. That makes it one of the top 10 counties. So why do I say, here are the facts? Well, because Labor Day weekend is coming up, and many will want to go to the beach. Many will want to gather. And we are living in a world and in a county where coronavirus still exists. This virus, as you know, is highly communicable. It is easily spread when people are in close proximity. And some studies have shown that people who have the virus are most contagious in the first few days before symptoms show up. That's not a hard, fast rule, but that's a good general understanding. You cannot assume that you or your friends do not have it if you do not have symptoms. That's a bad assumption. You have to assume it's out there. You have to assume that what you can do is to help slow the spread of the virus. Now, many, including myself, believe that the beach is safe in many ways. Many ways. Sunshine, according to many studies, can kill the virus. And there is some half-truths in just that statement without qualifications. Sunshine can kill the virus on surfaces. And some studies say it can do it in less than 6 minutes. But people who have the virus, we know, are constantly shedding this virus. So yes, sunshine can kill this virus, but when people are in close contact, they can infect others quicker than the sun can kill it. Now, we all treasure these beaches, and we love our families, and we love family gatherings. But we cannot have mass gatherings because they will turn into mass infections. We cannot have mass gatherings because they will turn into mass infections. And I want to encourage all locals and all visitors who come to our beach to do so responsibly. And please do your best to spread out. Keep your families who live in the same household together, no greater than 10, and give everybody else a bunch of room. You've told me for weeks and weeks and weeks, those of you who were really against closures, that you know how to spread out. I believe you this weekend. Show me. Show everybody how we can do it right. Bring your sanitizer, wash your hands. When you stop for gas or the grocery store or the Stripes, make sure that sanitizer is there. Keep those wipes handy. Make certain that mask is on when you're going to and fro. Even if you're really getting close to other groups, if you're not swimming, make sure that you're doing everything you can to protect yourself. It's up to all of us to do our part. And just as your mask protects both you and your neighbor, everything we do helps ourselves and helps those around us. Please, please be safe at the beach. Our beaches are beautiful, but they can also turn into outdoor bars if you're not careful. Make certain that you're doing everything you can to absorb the sunshine and all that wellness and leave all that bad congregate settings behind. I've got a top 10 list for beach safety, and the truth is I'm going to read it quickly because I want to say one final comment about beaches. Here it goes. Swim near a lifeguard. Swim with a friend where you can keep eyes on one another. Be sure you're checking as to where those lifeguards are. Keep hydrated, sunscreen, obey posted signs and flags. Hey, keep everything clean out there. Bring your own trash bag if you need to. Make certain you know about our rip current safety in those red flag days. Enter the water feet first. Don't be diving in when you don't know what's down below. If you've got someone that doesn't swim, please put a life jacket on them. And stay within your swimming and fitness capabilities. Now, a couple of nights ago, it was late, and it never bothers me because we talk late all the time, but Director Rodriguez texted me. She wanted to know why the beaches would be open when there was absolutely a certainty that they would be packed. For once, I had nothing to say. Because I know that her worries are valid. I know she must be scared because I'm scared. Because what you don't know that we do is how absolutely traumatizing and frightening it was in the month of July. For our hospitals, our healthcare workers, for our health department workers, for all of us trying to figure out how we were going to get the right amount of staff and supplies. And all of that had to do with Memorial Day weekend. So here's my answer to you, Annette, and to everybody watching. There are no restrictions from your county judge this weekend because I have to have integrity with what I say. And what I said was that I would let the data drive my decisions. And as I stand here, I stand very worried and very scared because I know that there will be lots of people who won't do it right. But I am praying really hard that you are listening and that you will not allow your neighbors, your friends, your children to go out there and not practice what we have preached, what you have preached. If you do it right in your home and in your work setting, you can do it right on the beach. And if you cannot, don't go. In fact, I'm going to share with you something. I love this beach so much, but I love it more when it isn't 3 deep pack. Go on another weekend. And for those of you that are coming from around Texas or know people, I'm going to remind you again, Texas logged the most cases, second in the country to California this past week. Coronavirus is, if you don't think it's here, I'm going to tell you something. It's definitely in Harris County. It's definitely in Bexar County. It's definitely in Hidalgo County. It's everywhere around us. And so it's critical that we understand that if you want that personal responsibility, you better be ready to exercise it. Because just like that, we can be back in July, and it would take us 2.5 to 3 months again to recover. Let's not go back there. But I will stand by my word, because my word means everything to me. And I said the data would drive my decisions, and the data today is so much better than where we were in July and where we were in August 1st. So finally, let me say that we're going to know. And we're going to absolutely have to prepare for the worst. But we all have choices and free will, and I'm going to beg you to make sure you're making the right choices and the right decisions for your family and for people that you love. I'd like to take the last moment to remember that it's Labor Day, and Labor Day pays tribute to the contributions and achievements of American workers. And it became a federal holiday way back in 1894. And I know I've gone over tonight, so I'm going to kind of get back to the crux here of my notes and just end with that workers make our lives better. Every worker deserves to work in a place that's safe, pays a fair wage, and respects the dignity of the men and women who do the jobs that make our lives better, our communities stronger, and our countries more prosperous, and our future more secure. In fact, the inspiration I have today for all of our hard work, particularly yours, Annette, and all the men and women at the health department, is that without labor, nothing prospers. Your labor should be honored this Labor Day by making the right choices. I know that's a lot to hope for, and we're not in the business of hope, because hope is not a strategy. But I will tell you that the work that we have done to prepare with our COVID clinic, with our alternate care site, with our increased testing, our case management, and our soon-to-be public messaging campaign has given us a better edge than we had in July. And I hope that all of those efforts together, along with the new data, will mean a better result for all of us. Dr. King said that no work is insignificant, and I believe that. All labor that uplifts humanity has dignity. All labor that has dignity and has importance should be undertaken with excellence. There is excellence in our county, but there is only so much we can do. And the rest, my friends, is up to you. So, I won't be at the beach with you this weekend as much as I love it. I'm going to make the smart choice, and I'm going to stay home. And I'm going to choose to go visit Padre Valle, the namesake of my own family, on another day in September. Thank you so much.
Quiero comenzar a dar información para los padres de familia, ya que el Museo de Ciencia e Historia cuenta con 40 posiciones abiertas para los niños. Para más información puede encontrarla en la dirección ccmuseum.com. Quiero aclarar información en cuanto a la orden de las playas emitida el pasado miércoles. El huracán Hanna causó daño significativo en el área del muelle Bob Hall, dejando escombros y haciendo el lugar peligroso para los visitantes. Además, se deben de restaurar las dunas. Este trabajo requiere de contar con maquinaria pesada, por lo que se tuvo que tomar la decisión para proveer con seguridad a los visitantes. Cerramos un área pequeña y le pido tomar todas las precauciones en el área, la cual reabrirá en cuanto sea posible. El estado de Texas continúa teniendo un gran número de fallecimientos debido al virus. Cuando una persona enferma seriamente puede morir. El radio de muerte es de 1 en 52 personas. En cuanto al fin de semana feriado, muchas personas posiblemente van a acudir a la playa durante este fin de semana, pero recuerde, el virus es altamente contagioso aún en la playa. Algunas personas asumen que no se pueden contagiar porque los rayos del sol destruyen el virus, y aunque eso tiene algo de cierto, cuando la gente está enferma y está en contacto directo con otros, pueden infectarlos. Fácilmente, si va a la playa, le pido que lo haga de manera responsable. Estos son algunos de los consejos antes de ir a la playa. Nade cerca de un salvavidas, nade acompañado, asegúrese de que haya un salvavidas, utilice un bloqueador solar y tome agua suficiente, obedezca las órdenes que se encuentren en ese lugar. Mantenga las playas libres de basura, aprenda a nadar para salir de una corriente que lo ponga en peligro, y si va a entrar al agua mediante un clavado, entre con los pies primero. Utilice un chaleco salvavidas si es posible. Este fin de semana no van a haber restricciones en la playa, pero como le dije, yo baso mis decisiones en los datos. Espero que usted tome todas las medidas para evitar contagios. Así evitaremos que los hospitales continúen llenos y haya más personas infectadas. No queremos regresar a lo que experimentamos en el mes de julio.
Okay, that concludes our formal remarks, and it's pretty close to 6. We want to see if anybody has any questions from the media. Okay? Okay, no questions. So just for housekeeping, the next briefing will be next Tuesday. We know Monday's Labor Day, so we'll be back here next Tuesday. And Tuesday we'll update you on the numbers. There may be some comments from the judge and the mayor, if they're here, and Annette and myself. But that time will be mostly focused for Dr. Bird from Texas A&M University. He and his team will show us updated modeling and projections for Nueces County. All right, so thank you. Have a good evening. Have a safe weekend. Thanks.